Hi, I'm Courtney Skarazinski. I'm going to be doing my suture demonstration video for you today. When you are doing sutures, you're going to be doing them on primary closures of skin lacerations that extend into the dermis and on wounds that you expect to have excessive scarring because they require the wound edges to be properly closed. When doing suturing, you're always going to want to do them on clean, uninfected wounds that have occurred less than 18 hours ago, and that will just ensure that you're not having an increased risk of wound infection. And the equipment that you want to have on hand is, of course, your clean or sterile gloves, your sterile field if you're in that environment. You want to have your analgesics that you're going to be using, your irrigation solution, as well as a 60 cc syringe and a 19 gauge needle, and then you're also going to have your suture tray. And that will contain your needle holders, your tissue forceps, your scissors, your hemostats, some gauze if it's required, and then also a 10 and or 15 blade if you need to debride the wound. Now the first thing that you're going to do is apply your analgesics to the wound, and you're going to use most likely either lidocaine, Marcaine, both 1%, or you have bupivacaine 0.25%. And you can do all those with or without epi, but you want to make sure that you're not using epi on your digits, your toes, or your ears. When determining which analgesic to use, it really depends upon the length of the procedure, if you require hemostasis, the patient's sensitivity and condition, and then their allergies as well. If you are doing sutures on a pediatric patient, then you're going to be taking care of pain control by using a topical lidocaine, epi, or tetracaine. Now, after you've adequately administered your analgesic into the skin, then you're going to begin irrigating the wound. You're going to irrigate using normal saline, or you can also do a dilute 1:10 ratio of betadine and normal saline if you believe the wound is contaminated. Now, you want to achieve an adequate irrigation pressure, and that's going to be about 5 to 8 pounds per square inch, and you achieve that by using your 60 cc syringe and your 19 gauge needle. Now, when it comes to your suture selection, you have absorbable or non-absorbable. Your absorbable sutures have to be tied 3 times to achieve a secure knot, and your non-absorbable sutures have to be tied 5 times to achieve a secure knot. When determining the type of suture to use, you want to make sure that you're choosing the proper suture that's going to decrease risk of inflammation and infection, as well as maintain your tensile strength for wound healing. Now, the suture size, if you have a larger suture size on the package, that is a smaller suture and it has a lower strength. Your smaller sutures, such as 5 to 6-0, those are usually used if the wound requires close approximation or for areas of cosmetic importance. Now, the larger sutures, which is like the 3 to 4-0, those are usually used on gaping wounds to close them. To determine if you're going to use absorbable or non-absorbable sutures really depends on the skin layer that's involved in the wound. If you have a percutaneous closing that you're doing, you're going to be using a non-absorbable synthetic suture. You can also use a fast absorbable gut, a vicryl, or a chromic gut. If you're doing a dermal closure, then you can do absorbable sutures, and you want to make sure that they can maintain their tensile strength until you have collagen formation. That's going to help with wound healing, and that's usually like your vicryl or monocryl. If you have an oral laceration that you are closing, you're going to do an absorbable suture such as a chromic gut or a rapid vicryl. Now, for interrupted sutures, which is what we're going to be doing here today, you want to make sure that you're grasping your needle kind of with a little left at the tip here, and then you're getting close to the end of the needle holder there. And then you're also going to be going in kind of midline to the wound itself that you're going to be closing, so that as you're placing the sutures, you can receive a good approximation of the wound edges. You're gonna go in at a 90-degree angle to the skin surface. Come up, you wanna grasp it on the other side and pull it through, leaving some at the end that you can use to tie off your suture. You're first gonna go twice towards the wound, grabbing your end of the suture here, pulling it through and making a knot. I'm then going to lock the suture by going once away from it, again grabbing the leftover there and pulling it through. And we're going to do, since this is a non-absorbable suture, we're going to do 5 knots. Again, we're going to go towards the wound, grabbing the end, and then when cutting, you want to make sure that you're leaving enough suture on either side that when the stitch is removed, it's easier to take out by the nurse removing it, and so that it's not irritating the patient. Now, when placing your knots, the goal is to put the knots on one side or the other of the wound itself. That way, you're not interfering with wound healing. Go in for my second suture here, and you want to make sure that you have proper width and depth of your suture loops. Grabbing the end there to tie it, and then away from the wound itself to lock it. Again, towards the wound, and you're just going to do one time now, just to continue your knots. Okay, and then we'll go ahead and cut it again. Again, leaving enough on each side so that the stitch can be removed at a later date easily. Okay, we'll go in. I'm going to go in on the other side of this stitch, again trying to achieve good approximation. Now, when placing your sutures, you always want to start at the center of the wound, and then the other sutures, if this was a smaller incision or wound here, you would go in between the center stitch and the wound edges. We're going to knot this nice and good. So far all my knots are on the same side, and that's the goal, is to have them on the same side, nice and even. Cutting, leaving enough on each side. Now, the aftercare of your sutures, you can apply antibiotic ointment such as bacitration to them. However, the first thing that you're going to most likely do is do a dressing, and you can do an open dressing or a semi-occlusive dressing, and it's really dependent upon the amount of drainage that you expect from the wound itself and really what kind of suture that you're using. If you expect the wound to drain a lot and or you used a non-absorbable suture, then you want to use, as your dressing, sterile gauze or an adhesive bandage, so that wound stays nice and clean. Now, if you do not expect any drainage from the wound and or you closed with an absorbable suture, and then you can do an open or semi-occlusive bandage, and that would be something like a Tegaderm. And that dressing is going to stay in place for the first 24 hours at least after the suture placement. After that, you can remove the dressing and you can just keep the incision or wounds that's closed properly with the sutures open to air. And then at that point, you would begin applying your antibiotic ointments such as bacitracin, and you would do that BID until the sutures are removed. Now, when it comes to bathing while you have sutures in place, both non-absorbable and absorbable sutures can be gently cleansed with mild soap and water or half-strength peroxide. And you can do that 24 to 48 hours after the sutures are placed. Now, the length of time that sutures are going to stay in until they're removed depends on the anatomical area that they're at. For non-absorbable sutures, for the face, they're going to stay in for 5 days. For the neck, it's going to be 5 days. For the scalp, it's going to be about 7 to 10 days because the scalp bleeds more. And then for the trunk and upper extremities, I'm going to cut that one. That one's a little too loose. Last stitch there. The trunk and the upper extremities, it's going to be about 7 days, 7 to 10 days. Your lower extremities, those sutures are going to stay in place for 8 to 10 days. And then your hands and feet, those sutures stay in place the longest. They'll stay in place for about 10 to 14 days. And then for your absorbable sutures, your absorption rate is about 5 days for a fast absorbing gut suture. And then for your rapid vicryl, it's going to be about 7 to 10 days. Cut this one here. Again, leaving enough on each end. And then you have your 5 interrupted sutures.